You've seen them, right? If you're on social media at all, you've seen the doctors, the nurses, the therapists, all sharing health advice directly to your feed. And look, this explosion of medical influencers has totally changed how we get information. But with all that influence comes a huge amount of responsibility. So today, we're going to dive into the ethical tightrope these professionals are walking every single day. This is really the heart of the matter. In this digital world that is just obsessed with likes and shares, it's so easy to mistake the loudest voice for the most credible one. But when we're talking about our health, what really matters isn't reach, it's reliability. It's about integrity over virality, every single time. So let's be super clear about this. The med influencer isn't just some passing trend. No way. It's a fundamental shift in how we talk about health. The clinic has basically broken out of its physical walls and gone completely digital. Healthcare professionals are now communicating on a scale we have just never seen before. So what does this digital practice actually look like? Well, it's a huge spectrum. You've got them sharing incredibly valuable educational content. You've got them actively debunking harmful myths and championing preventive health. The potential here to improve public health literacy is just immense. But this new frontier also brings with it this really complex web of ethical challenges. And this really brings us to a critical realization. For health professionals, being online isn't a choice anymore. It's just a reality. The debate is no longer about whether they should be there. The urgent question we all need to be asking is how they show up and what ethical standards they have to uphold. So, how do we navigate all this? The fascinating part is that we don't really need to invent a whole new ethical code from scratch. The real challenge is in applying these timeless, long-standing medical principles to these brand new, super fast-paced digital platforms. And what's really remarkable is how perfectly these core principles translate to the digital world. You take beneficence, the duty to do good. That's not just about clinical care anymore. Now it's about sharing accurate, helpful info online. Or non-maleficence, do no harm. Well, now that's about actively fighting misleading content. See? The principles are exactly the same. It's just the platform that's changed. Okay, but let's be real. Applying these principles online is far from simple. This new digital landscape is basically an ethical minefield, and medical influencers have to tread very, very carefully. And here it is. This is the fundamental tension. Social media algorithms, they thrive on engagement. They often reward sensationalism and drama. But good medicine, that's all about nuance and balance and careful explanation. So how on earth do you reconcile a system that rewards clicks with a profession that absolutely demands caution? The solution, really, is a disciplined commitment to trust over clicks. It means rigorously verifying your evidence before you even think about sharing. It means resisting that temptation of oversimplified, clickbaity claims, and always, always clearly separating established fact from your own professional opinion. Look, a sensational headline might get you some temporary attention, but it's the balanced, accurate information that builds the lasting trust that patients truly deserve. Here's another critical line you can't cross, the one between general education and specific medical advice. Providing public education online is a massive benefit of these platforms. But the second you start giving personalized advice, you're creating a doctor-patient relationship where one just shouldn't exist. The goal has to be to complement clinical care, never, ever to replace it. And then, of course, there's the whole issue of sponsorships. As brand collabs become more and more common, transparency is completely non-negotiable. It's actually a pretty straightforward process. You always disclose the financial relationship, you're honest about a product's limitations, and you never exaggerate its benefits. The moment an audience even suspects they're being sold to, not educated, all that trust just evaporates. Now, patient confidentiality. This is, of course, paramount. It's an absolute. But in the digital age, we have to think about the permanence of everything we post. A story or an image that seems anonymous can live online forever, and even tiny, subtle details can risk revealing a patient's identity. In this arena, the stakes are just way too high for any kind of misstep. Okay, so we get the pitfalls. Let's shift our focus to the solutions. How can medical professionals use their platforms not just to share good info, but to actively fight the misinformation that spreads so quickly? Well, it all comes down to developing a really strong digital bedside manner. This philosophy right here is key. The goal when you're addressing misinformation isn't to win some argument in the comments section. It's to patiently and clearly promote understanding, not just for the person you're responding to, but for everyone else who's watching from the sidelines. So what does that actually look like in practice? Well, it means correcting with evidence, not with anger. It means deliberately avoiding those hostile back and forths and focusing on teaching rather than fighting. And crucially, it means using clear, accessible language that anyone can understand. This is the approach that builds bridges of understanding instead of just putting up walls of confrontation. So, as we wrap up, let's just zoom out and consider the bigger picture. We've talked about the methods and the pitfalls, but let's end with the fundamental why. What is ultimately at stake here? This, right here, is the core risk. An online platform gives a healthcare professional enormous influence. But when that influence isn't anchored by a strong ethical framework, it can quickly lead to widespread confusion and even cause real, actual harm in the real world. But, and this is a huge but, the flip side is the incredible power for good. When it's wielded responsibly, this exact same influence can literally transform public health. It can improve awareness, encourage people to take preventative action, and build that desperately needed trust between the medical community and the public. And all of this leads to a really crucial takeaway. Effective, ethical online communication is not a soft skill. It's not some optional add-on. It is a core clinical competency, just as vital as diagnosing an illness or reading a chart. It demands intention, reflection, and a very high degree of accountability. So I'll leave you with this final critical question. In an era of just complete information overload, where everybody has a megaphone, who truly earns our trust? The answer, it seems, isn't found in the volume of the voice, but in the responsibility with which it's used. Thanks so much for joining me.